Hello. Hi, everybody. It's Dr. Andrea. Happy Wednesday. I am coming on to talk with you guys today. I'm going to try to share this video. And my dog says hello. Going to pull this up and wait a minute to see if anyone's going to join us today for the talk on Baby Talk with Dr. Andrea. Let's see. We are halfway through the week, close to the weekend. Just pulling this up now. Let's see if we can share this. All right, pulling it up. I tried to do this before and haven't been successful, but I think we should be good today. All right. Perfect. Brody. All right. So I'm going to go ahead and share that. Hey there, I see somebody just joined in. So I got that shared. Perfect. Again, happy Wednesday. I'm Dr. Andrea. As you know, I am your board certified pediatrician and newborn expert. I teach new and expectant parents how to prepare and care for their newborns. And today I'm coming on talking with you guys about kind of a big topic. I'm going to try to cover most of it tonight and do a little recap at the end, but it is an important topic. And basically tonight I want to talk with you guys about, is it possible to prevent eczema, also known as atopic dermatitis, and food allergies in new babies? Some parents have these concerns because either their child that they already have has this issue, or they've dealt with this issue throughout their life, or the father or the mom. So a lot of parents will want to know, is there something I can do to make it less likely that my baby will get this eczema or these food allergies? So let's go ahead and get started. And if you guys have any questions during the live show, go ahead and jump in and ask me. I'll try to answer them for you, or I'll answer them at the end. So the first thing that we want to talk about is, what is eczema, or also known as atopic dermatitis? So basically, eczema is a skin condition where you tend to get patches of red, itchy, dry skin over the body that can come and go or can be more persistent. Typically, you'll see eczema kind of presents in about 15 to 20% of children under the age of 18. And children do tend to grow out of this. Probably about, I would say, over half of them can actually grow out of this by the time they reach their teenage years. And then when it comes to things like food allergies actually affect about 8% of children in the U.S. under the age of 18. And that could be one food allergy, or that could be multiple food allergies. It can vary. And then you can be allergic to almost any food. So there's quite a variety there. But then we have those foods that we call like our highly allergic foods, or I would call them the top 8 highly allergic foods. And those are going to be the ones that cause most of the allergic reactions, especially the severe reactions. And those are going to include your cow milk protein, your soy protein, your wheat, your eggs from chickens. Then you have your peanuts, your tree nuts, your fish, and then you also are going to have shellfish. So those are kind of like the top 8. You'll hear me refer to that later, the top 8 highly allergic foods. So when it comes to these foods, you can actually grow out of some of these food allergies as well. So 4 out of 5 children will grow out of those first 4. So that's going to be your cow milk, your soy, your eggs, and your wheat. Okay, so about 4 out of 5 children, by the time they reach kind of kindergarten, can grow out of that. The other ones, like your peanut, that's going to be much lower, like 1 out of 5 children outgrowing that. And then the shellfish, the other nuts, things like that are actually much, much lower. So if you fall in that category, it's less likely that you'll grow out of it as you get older. Excuse me. Going back to the atopic dermatitis or the eczema, when children tend to get this, about a little over half of them should start actually showing symptoms of it before they even turn 1 year old. And by the time that they're 5 years old, if they're going to develop it, about 90% or more of them will actually start showing symptoms. So you'll kind of see that early on and know if your child is going to develop these things. So one more thing I want to define for you all is something called atopic disease. So what is atopic disease? Atopic disease is a group of diseases that actually have a tendency for a person to be oversensitive to things in their environment. That could be the foods that they're eating, that could be the things that is around them, and it includes things like asthma, hay fever, also known as allergic rhinitis, And then the things that we're talking about today, which is going to be your atopic dermatitis, also called eczema, and food allergies. So if you hear me say atopic diseases, that kind of covers that whole group. And then before we move right into the subject that we're going to be talking about today, the food allergies and the eczema, I want you guys to understand that a lot of the research and studies that have been done to focus on babies that are actually at high risk of getting food allergies and eczema. So what makes you high risk for these atopic diseases? So the definition of that is a baby whose first degree relative, so either mom or dad or a sibling, brother or sister, have a known history of an atopic disease. So your asthma, your hay fever, your eczema, your food allergies. So if you have a sibling or a parent of that baby that has these things, that's going to put that child in that high risk category, okay? All right, and then just to cover, again, we're talking about, are there ways to prevent food allergies and eczema in babies, and what can parents do and what should they know, especially breastfeeding moms? So the first question people ask is about the pregnancy period, the earliest time. So some people ask, if I avoid those top 8 highly allergic foods when I'm pregnant, is this going to avoid the chances of my baby actually getting these food allergies? Well, they've looked at this, and actually the research has not really shown that if you avoid these things that it's really preventing these diseases. And actually they've shown in some studies that if you actually eat these foods, it can be protective against developing these food allergies. So as of right now, no, they're not showing that if you avoid it, that it's definitely going to cause a benefit to your baby as far as avoiding those food allergies. When it comes to lactating moms, they will often ask the same question. If I'm breastfeeding and I'm concerned about food allergies, hey there, should I then avoid eating these highly allergic foods? If I avoid these top 8 foods, is that going to prevent my baby from getting the food allergies or other kind of atopic diseases? Again, they have not found that specifically this is going to prevent the baby from getting those food allergies. One thing that they did find is there's some small amount of data that says that if you avoid these foods, that maybe the babies will be a little less likely to get eczema, but again, that's a small group of information, needs to be further studied. But when it comes to your food allergies, for your asthma, hay fever, it is not showing that avoiding these things is actually going to help you with that. So now let's talk about exclusive breastfeeding overall. So is there a benefit to exclusively breastfeeding, which means you're not giving formula and you're not giving other complementary or solid foods? So yes, they actually found 2 big things about this. So for moms that exclusively breastfeed up until at least 3 months old, they found that it actually showed a decreased incidence of wheezing in these babies. And then also when moms exclusively breastfed for at least 4 months, for the baby's first 4 months of life, they actually saw that it decreased the incidence of actually the baby getting eczema and cow milk protein allergy. And now these babies were babies that were actually compared to babies that were drinking regular formula. So that's your typical cow milk formula, like, run-of-the-mill, not any kind of specialized formula. So absolutely, there is some benefits that have been shown for breastfeeding. So if you're thinking about that, that may be something that can be helpful for you and your family. So now that we brought up formula, let's go ahead and talk about formula, because some babies are only on formula. So is there something that they found about formula that is actually important for preventing allergies and atopic disease in babies? So when it comes to formula, they did show in some studies for high-risk babies, again, those babies who have family members, brother, sister, or parent that is known to have atopic disease, they found that if these babies ate partially or extensively hydrolyzed formulas, cow milk protein formulas, that it was shown to decrease the risk of eczema. So what does that mean? So that means that these are formulas that are cow milk based that actually have the proteins, the cow milk protein broken down a little bit, almost like it's partially digested already for the baby. So when you see the formulas that have partially digested protein, it usually will say something on there like gentle proteins or easy to digest proteins. Those are your partially hydrolyzed proteins. Then you'll see the ones that say hypoallergenic, or for babies with protein allergy. Those are going to be your extensively hydrolyzed products, which are much, much more broken down. So one thing to keep in mind is that there can be a very big difference in price between these formulas. With your standard cow milk formula, even your partially hydrolyzed and extensively tend to be much more expensive. So if you're considering these things, by all means, I would encourage you, if you have this history in your family, to talk to your pediatrician or your doctor so they can guide you on this, give you samples of it if it's necessary to see what is best for your child. Another thing to think about for formula is going to be soy formula. So people ask me a lot about soy formula. Is this good for the baby? Will it prevent these things? Well, actually, studies have not shown that soy formula has the ability to prevent any of these food allergies or anything else in that category. And in general, in my own clinical experience with patients, I have not found it to be that helpful. If it's something that the parent wants to try, by all means, that's up to you and speaking with your doctor. But as far as preventing allergies, they have not found that soy formula specifically has any evidence of doing that. Okay? So now let's go on to solid foods. When you're introducing solid foods to a baby, what are some things that you should keep in mind? Well, I talked before about introducing solid foods to babies, and it's pretty well known that if you introduce baby foods to an infant before the age of 4 months old, when their digestive tract is still immature, you actually can increase the risk in them of getting things like eczema, the atopic dermatitis, as well as other things such as celiac disease, which is when you're seeing the gluten intolerance in people. Obesity can be increased, as well as diabetes. So that is just something to know. Introducing foods too early can lead to increased risk of things like eczema. There used to be a recommendation out by the American Academy of Pediatrics for a while that encouraged people for like peanuts and those high allergy foods to delay introducing those foods to their children, I think even up until 3 years old, for concerns that this may decrease their risk of actually getting those allergies. Well, they recently have changed this recommendation, and that's because after they recommended this and they looked at these children, there really wasn't any evidence showing that delaying these foods for a prolonged period of time actually prevented the child from getting the food allergies. So that's really not a recommendation that is made any longer. So basically what they're saying is when a baby actually starts eating baby food, when they're developmentally appropriate, usually after the age of 4 to 6 months old, there is currently no recommendation that you need to prolong and delay those typical foods that are recommended by your doctor. Okay? Now there is one specific thing that there is a new guideline on, and that is peanuts. So you guys may have heard about this, you may not have, but specifically for peanuts, there's a new recommendation on how to introduce this, and now we're specifically talking about those babies that are at high risk specifically, and then some that aren't at high risk. So when it comes to the peanut introduction and we talk about high-risk babies, there's 3 categories. So the first is the highest risk for children to possibly get peanut allergy, and those are going to be infants that have severe eczema, known egg allergy, or both. So what is severe eczema? Severe eczema is basically a baby that has eczema outbreaks that is pretty much there persistently all the time, and that they typically will require prescription medication to try to control these outbreaks very frequently. That's going to be your more severe eczema category. And then, of course, the known egg allergy, or if you have both of these. So if your baby falls into this category and you do not yet know if they have a peanut allergy, what's recommended now, early on, even when after birth or at 2 months old, you want to talk to your doctor about it because they recommend that the baby get testing for peanut allergies. That may be a blood test. That may be a skin test at the allergist office, but you want to speak with them and have this testing done, and based on those results, that'll determine the appropriate way to introduce peanuts to your babies. And once you have that information, the recommendation actually is to introduce age-appropriate peanut products to those infants around 4 to 6 months of age when they're developmentally able to take it and take other foods to help prevent that allergy, okay? Now, the second category is going to be your babies that have more mild to moderate eczema that do not have egg allergy. These babies don't have, it's not recommended currently for them to get testing before getting introduced to peanuts, but the recommendation is about 6 months old and when they're developmentally ready and eating other solid foods to go ahead and introduce the peanuts into the diet. Age-appropriate foods, that they actually have some on the market now that's specifically for this, and it is a certain amount and a certain quantity at a certain given time for a certain duration. So you do want to talk with the doctor about how to do it, but basically 6 months and later is when you want to introduce for that group. And then the last group is going to be your babies that have no eczema and no known food allergies. And for this group of babies, which is a lower risk, they recommend that you introduce the peanut products freely in age-appropriate types of foods to those babies when they actually have started eating the solid foods. There's not a specific time, but basically they recommend starting it when they are able to eat solid foods, other solid foods, to make sure that it's safe. And there again is no recommendation now to delay foods until later to try to prevent allergies. Okay? All right, one more thing I'm going to cover is probiotics. Probiotics, we hear about them a lot for different things, but there actually is some research around probiotics and prebiotics about preventing atopic disease. So just a quick review, a probiotic is basically a beneficial or good bacteria that's found naturally in our digestive tracts. It's actually found in breast milk too. And then prebiotics is the non-digestible food that these bacteria feed on, which is also found in our body and things that we eat, and also in breast milk. So they've done some research about introducing this to babies, and what they've actually found is in several studies, it did prevent or decrease the incidence of eczema, which is very interesting. But what's important to know about that is there are several different types or strains of probiotics. There's not just one. When they did these studies, the one that they found was most consistent with this finding was one called Lactobacillus rhamnosus. But then there are other ones that discuss as well, but that one was more frequently found in these studies. But what they were not able to identify or recommend is a certain dosage of that probiotic. They couldn't say exactly when it should be started, how long it should be given, lots of other factors that they can't quite tell us right now to tell us what is the best way to introduce this probiotic for babies and for families. So right now the recommendation is it's not in general recommended that families need to start this for their babies. Probiotics generally are considered safe, so if this is something that you want to do or to try, then it probably is fine. But what I do recommend is that you talk with your pediatrician or your doctor about it before starting anything, even natural or over-the-counter products for your baby, to make sure that they don't have any concerns regarding it, to make sure that you choose a brand that is safe, because these are not regulated by the FDA, and just so that you're doing what's best for your baby. So if you're interested in trying probiotics, again, they're generally safe. They may actually help to prevent eczema in your child, but again, speak with your doctor about it so that they can guide you and help you do what's best for your baby, especially if they're preemies or if they're immune compromised. All right, so a quick recap. If you guys have any questions, again, throw them in the comments and I'll answer them for you. But again, we're talking about, are there ways to prevent food allergies or eczema in babies, especially for those high-risk families or babies that are high risk because they have a family history of these things and a parent or sibling. So one, really quick, for pregnant moms, should you be avoiding these highly allergic foods to try to prevent this allergy in your baby? Again, research has not shown that this will be effective in preventing this in your baby, and it actually may be protective to have it in your diet. And you overall want to make sure that you're just eating a healthy diet so that you have enough nutrition for yourself and for your baby. For those lactating moms, same kind of findings. They don't recommend that you're avoiding these things in your diet unless you know that your baby has an allergy, then that's different. So if they have an allergy, do avoid those things. But if you're not sure and you're just trying to prevent it, they have not found that this will prevent the allergies or atopic disease in your baby, except for a small portion that may prevent eczema. Exclusive breastfeeding for the first 3 months may actually decrease the likelihood of wheezing for your baby. Exclusive breastfeeding for the first 4 months can actually reduce the incidence of cow milk protein and eczema in babies when compared to babies that are eating regular formula. When it comes to those formulas, for families that have babies that are at higher risk because of that family history, a partially hydrolyzed or extensively hydrolyzed formula, which means that the proteins are already broken down a little bit, or when they're extensive, it's hypoallergenic, that may actually decrease the risk of eczema in babies. Soy formulas do not specifically decrease the risk of atopic disease that they have found so far. And again, there's new guidelines for introducing peanuts to babies that may actually help to prevent that disease. I won't go through all of that again, but you can watch the video if you want to look at that as well. And remember, when it comes to introducing solid foods to your babies, don't do it early. Don't do it before 4 months of age, because you may be increasing the risk of eczema and other diseases. And again, the old guideline where they recommended for those highly allergic foods to not introduce them for a few years, they did not find that that prevented those food allergies, so that is no longer a recommendation. They just generally recommend that you introduce them to your baby if you're not sure yet that they have the allergy at the age appropriate time. I hope that you guys found this helpful. Again, leave a comment, ask a question. If there's any other topics that you guys would like me to cover, I am happy to do that. Just shoot me a message. Again, I am Dr. Andrea. I'm your board certified pediatrician and newborn expert. I teach new and expectant parents about how to care and prepare for their newborns. Go ahead and follow me if you like on all social media at Dr. Andrea MD. That's DrAndreaMD. And you can also follow me on my website, which will link right back to here at drandreamd.com. Have a great evening, everyone.